Welcome to the breakout session. Just to make sure that everyone has space. This is Understanding Huntington Disease with Dr. Gabrielle Morelli. Dr. Morelli is a neurologist from neurodegenerative in Brazil and a moment disorder specialist trained at the University of Calgary. As a result of his clinical and academic background, along with special interest in Huntington disease, Dr. Morelli received the Clinical Fellowship Award from the Huntington Society of Canada in 2022. In terms of research, he's particularly interested in behavioral profile for neuronal and early stage Huntington disease patients. He's also one of the investigators in the Enroll HD observational trial at the University of Calgary. Understanding the observational studies are vital and comprehending clinical disease progression, risk factors, and clinical outcomes. Dr. Morelli is also involved in various observational studies in autoimmune disorders such as Parkinson's disease and Tourette syndromes. Today, Dr. Morelli will discuss the importance of observational studies and how to participate in observational studies are vital. And I heard debate. Our observational studies are vital for understanding neurodegenerative conditions like Huntington disease. The scientific data gathered in this study will guide future intervention and help clinicals better advise patients about risk factors and what to expect from the future. This session will highlight how the observational studies have been greatly allied in providing better care for Huntington disease patients and how to participate in them to help with Huntington disease research. Dr. Morelli, over to you.
Okay, thank you. I'll use this one. Let's see if that works. Okay, can you hear me? Okay, good. So, Dr. Morelli, I know a lot about Calgary, but I'm an audiolist, so not so big. But so I was, as Terry said, I was a former fellowship granted from the HSC, so it's an honor and a pleasure to have you guys have been here today, and it's a little bit of the payback that I can give to such a warming, welcoming community services during my training and how it's a faculty. So I want to welcome people online as well, 24 participants. So we want I want to talk 25 minutes. So I want to talk a little bit about observational studies, which I believe are the core about initiating any research in such a complex disease as Huntington's. So I think that most of what I'll discuss here, it's about challenges, and I believe we all know. The challenges are everywhere, including in research of Huntington's, especially in rare diseases overall. So every time you're facing something that is not common, I think the first step is how you gather all those people that are impacted by the disease, and not only the patients, but their families as well, to be a community and help with research, understanding, and awareness. And I think that mainly this is something that the HSC has been doing for a while, and this is such an amazing tool to help with research. And when we also talk about Huntington's, we're talking about a disease that is fairly complex. So the clinical presentation is broad, as we know. It changes when the disease has its onset. If it's a young onset, if it's like an average onset, it changes how it progresses. It varies from individual to individual. So putting this information together is vital if you want to reach our goal that is having better management tools and other biomarkers and diagnostic tools along the way. So I think this is kind of the reason why observational studies are so important. I'll try here to highlight this importance and maybe kind of making you more interested in participating as a patient or as a family member, as a control group. We'll talk a little bit more about it. So it's kind of this boring slide, but we have to talk a little bit about scientific method, because I think this is key. This is key to anything that we want to accomplish. As we know, like in a kind of our daily life activities, we decide to cook a meal and we don't have a pattern, we don't have a method, but we're probably going to put the house on fire. So everything needs to have a method. And I think science accomplishes things because it has a method that it's always challenging itself. It's not a dogma. It's something that we are often wrong. And this is good to be wrong. It's good to be other people looking at it so we can kind of improve over time. And one of the key factors there, as you can see, like on this cycle, is observation. So observation is the first part to have better questions. That question will generate hypotheses, that will generate an experiment and results in conclusions, which is like the more classical pattern. But if you look at sometimes to generate better questions, the observation needs to be, and the data that we have gathered from observation, they need to be accurate. This is, I think, one of the main aspects that are important here, especially when we are dealing with such a complex disease as Huntington's. So I like to say, and I think it's a good metaphor to say that the observational studies and observation in science is kind of part of the pathway to achievement. We don't achieve the goal if we don't have the good data gathered from observation. We cannot, you'll never find any treatment if you don't know what you're dealing with. If we don't have a good idea, if we don't have enough data, we don't have enough population that will be evaluated to gather this data, we will never have reliable information to move forward. And I think a lot of even having all of this, still is a lot of trial and error. Still kind of things point towards that direction. We go through towards it, and often it's not like successful as we wanted to. But the pathway, I think, is a good observation. And that's why there's so much effort in this kind of study in complex diseases. So in a way, observational studies, they can be classified as a systematic observation and analysis of individuals or populations without direct intervention of the researcher, which is a good way of saying, I want to know what I'm dealing with. And please don't do anything to try and control. It's basically that. We will look at a certain population, we'll look how things will change over time. And the researchers won't be trying to control the goal in the end. We will not try to control and try to find a certain result. It's just to see how things will change. So I think the main aspect here is not controlling, because you probably heard, and some people might be even participating in the randomized control trials. So the control trials mean that we are selecting specific individuals, we are separating them in two different groups, we are giving a certain treatment or management or something, and we're seeing how things will change. This one, we are not doing that. We are observing and seeing how things will progress over time in the studies that we are going to discuss, the longitudinal ones. So what are they good for? I think I'm repeating myself a lot, but that's fine. I think it's kind of keeps the message going, but it's good for complex diseases. Especially good for that because there's so many different factors involved in it. If I look just at one individual, this won't be representative from the entire group. So let's say if I have a sore throat, probably the sore throat will not be so different from one person to the other. And good, there's no ENT doctors here, or they'd be mad at me, but it probably won't. You can get fever, you can get a sore throat, difficulties eating and such. Functionals can be many different phenotypes. And we know not only the phenotypes itself, but so how the disease presents, but especially how it progresses. It's so different. The milestones, the time things will change. And there are so multiple factors involved in it that it's sometimes we gotta look from the outside, because the multiple factors involved, they might not be the genetics itself. It might be environmental factors that we know they play a card, they cause and generate some differences in how things will progress over time. And this is something that sometimes if we control a trial, let's say we want to separate these groups and we want to see how things will be different. In the active side of it will be complicated. And I'll give you an example. Let's say if you want to see if substance abuse is a problem for developing and progression of a certain disease. it will be something that you lose your license if you just, okay, I'll give substance to this group and not to the other. So ethically, this is not something feasible. But in an observational study, you can do that because people are just free to keep having their life the way they want, and you observe it to groups and see how things do. So you can get enough information to see, okay, maybe this is a risk factor. Going to the bottom here, this is a risk factor for a worse outcome if the person had that or these or that kind of exposure before, right? And it's specifically really important for understanding the progression in minor students. And I think that's something that often we talk with patients is about adherence care planning. In diseases that we cannot really have so many tools to reduce the speed of progression, we can at least move ahead and understand how things will change, even though we often don't have a timeline. But at least we can say things will progress this way or that way, likely, so you should move ahead in time and try to organize your life. And I think this is really valuable because when you have that chance of preparing ahead and understanding how things will change, this is not something that you do during that crisis. During that crisis, it's really hard to make those decisions. So I think observational trials, they really help us with that. They help us understand how things will change over time. And let's say if we have, like we are having right now, this trials trying to different medications, this might be a way to find the best window of opportunity. Because we know that neurons, they cannot grow back, right? Once they be lost, and you can have to deal, and there are some ways that the brain will try to kind of compensate, but we often prefer to start the medication or start something before we have a certain progression. And in Huntington's itself, often the modern onset, it doesn't really show when the disease started. So having these observational studies that we can see how things change, especially in the pre-manifest stage when we have the psychiatric and some cognitive changes, we'll find the best window of opportunity in the future if we have something to better treat the disease. It helps us predicting progression to a certain extent, of course, and again, help people understand what's up ahead. And, I think that this is basically 100% of the time when you disclose a diagnosis and you get the genetic results and say you have Huntington's, the follow-up question is what's up ahead? What's up ahead? What should I expect? When this should happen? It comes all these images in your head because you have probably you have had someone in your family that you have seen. So am I going to that same place at the same speed at the same time? So I think observation studies help us a little bit with that as well. We can try to see the factors that we know that will kind of change the progression and kind of help with advanced care planning, which is so important. So this is an image that I think we will kind of summarize what observational studies are. I think they shed a light. They will shed a light on how things will change. They shed a light on what's the best time to try something. They shed a light what are the risk factors that I can avoid. They will shed a light on how should I expect that my disease will change over time. So I think it really helped us to create that pathway to our ultimate goal, that is having more options, but at the same time to know what's up ahead. And I think this is an image that helps us understand the importance of this kind of studies. Okay, but it seems like I'm preaching here and everybody's come out kind of saying observation studies are great for everything, but like everything in the universe has its own problems. One of the problems is ourselves, right? Humans and researchers. So we have to interpret that. And as you heard me saying, it's such a complex disease with so many variables that sometimes putting this together comes with a lot of problems. We may infer some things that are not great, especially because we are not controlling the study again. So we have so many variables. We are not controlling the group, and this is something hard to interpret this time. So this cause and consequence with so many variables may be hard to determine. And I think the other aspect for any research, and this is if you are talking with a researcher, is that there is no bias in research, it's either good or bad. We always have. We try to reduce as much as we can, but it's basically impossible. So observational studies, they will always have some sort of bias. When bias is maybe we are selecting this not really well. I'm just taking patients for a certain group from a certain city for a certain province, and there's a selection there. If I'm not being diverse about the group that I'm selecting, there's a selection there. But there's always a selection bias that you can't diminish, but you will always have. And I think the other aspect that is fairly important is that sometimes you have, because you're not controlling it again, you have so many compounding factors that it's hard to put up what is causing, what is consequence. Is there anything else that is interfering with what I've seen, or so these are always tough to deal with. And as we know, often happens, and I would say this in research, and I'll say this as a doctor, as talking to patients, we may not have many answers quite often. We may not, but I think observation trials, they help us have better questions. We have more data, and we can then turn this data into other researches, and this research will be more accurate and then finding some answers in the end of it. Okay, so this part is fun about the different types of observation studies. I will not do that with you, but it's basically there are a few. I think that the most important one is the longitudinal. Like the other ones, it's basically if you think that this is kind of population and time. It's always about that, population and time. So longitudinal studies, you get a population and you look then over a long time. It's like a cohort. It's a big group of patients that they have a certain aspect that you want to make a research about, say Huntington's disease, and you follow these patients over time. Case controls are smaller groups. You compare two different controls. Cross section of its time, and you take a look at it. It's like a photograph. I want to look at this group at this time only. Just a photograph, not a movie like a longitudinal study will be. In retrospective, is basically I'm looking at what happened before. So, which is always comes with more problems. The best way that you have better data is something that you can look up ahead, because then you can kind of prepare yourself and know what are the factors that you will be looking over time, and not just relying on what's like written in a chart that may not be accurate and may not have the best scientific rigor possible. So this is a way of kind of seeing these different observational studies. Okay, so I think this great graph that I made here. It kind of helps understand a little bit. So you see this person in the year one. Okay, I have a raised hand. We'll go through it in the end of the questions. So you have the year one, and then you keep following over time and see how things will change in different follow-ups that you have. You can do annually, every 6 months, but then you'll be basically repeating the same assessment or the same blood sample that you took, or basically gathering the same data over and over again and see how things change. So if I'm looking at mobility, you'll see the year one, there's independence, and year 6, the unilateral assist, and year 9, there's like persons dependent on using a wheelchair. So I can see how this changed and look this as a population. It will give me more information how mobility changed for a certain type of disease, for example. And where do I find this? So here in Canada, we don't have a specific database for observational trials. They have for the randomized clinical trials within Health Canada database and website. But we do have the clinicaltrials.gov, which is a tool from the USA, connected to the NIH, that will gather clinical trials all over the world, mainly in North America, but they also gather the observational trials. So it's a good place to start looking if you are interested. But I would say that the most important is to be connected to the center that provides you the system, because they will be the people that will tell you what's going on, what they're recruiting, what you're not recruiting, and what is up ahead, what may come in the future. So have like this connection and be in touch with the person that's providing assistance to you. And of course, HSC, for example, will also put like what is coming up in terms of recruitment. So you can look at different places, but if you have something closer to your residence, it would be easier to purchase things. So being in touch to the center that provides you assistance is always important. So if you look at clinical trials, like I did in late October, you see there were like 64 studies that were registered there, and from that 18 are recruiting at this moment. So like I told you, in this website you find who is recruiting, where is recruiting, but get informed with your local doctor or the clinic or the research facility that you're connected with. And how about the ones in Canada? At least the ones that I know of. Maybe you guys will tell me some that I don't. But there is this study is recruiting, is a study connected to another one that I'll talk later. It's called HD Clarity, which is basically like we discussed. It's a longitudinal study, right? We'll be looking at people over with basically 2 annual study visits, and it'll be collecting CSF, that liquid that we have here covering our spinal cord in our brain, and blood samples, and gather clinical data with it. And then we'll see the investigators, they will see if there are any changes there, anything that can serve as a biomarker. And what's a biomarker? What is so important? Because if you look at biomarkers for any kind of neurodegenerative disease, you see like all the fuss about it. It's just because right now we are having clinical trials for what we hope to be disease-modifying therapies. So if we want to see if a disease will change over time, then we rely on the physical examination, the neurological examination, or some of these milestones that we discussed. But if we have a lab work that will show, if you have 10 of these, it's more severe than you have 5 of these, and then you will be looking over time with certain therapy, and this number will be going down. It's a good and without with less bias indication that you have a successful treatment. So biomarkers, they are vital for that. They give valuable information. They are not so affected by our observation, especially for these clinical trials. They are fairly expensive and fairly sensitive as well. So it's really hard to make these predictions and getting a good idea of the results. So biomarkers are important for that. So this study will screen people based on the inclusion criteria or the kind of criteria that you need to enter this study, and we'll be collecting the samples, and we'll see if they can find these biomarkers and how these biomarkers will change. So right now we are recruiting in Ottawa. Vancouver is recruiting as well, and Toronto completed the recruitment as far as the information in the website. But it's always important, if you are living close to one of these areas and you want to participate, reach, you can find, they have their own website. You just Google HD Clarity, or you can look at the clinicaltrial.gov, or you can search me and send me an email, and I'll be happy to try to those coordinators in Ottawa for that. So this little letters there, little small letters, it's just reminding that for all the studies, there are inclusion criteria and exclusion criteria. So unfortunately, not everybody is eligible, but because again, we're not controlling so much, the inclusion criteria is quite broad for observational trials. We want to see people in different stages, pre-manifest, prodromal, in different stages after the disease is manifested. And this study is also connected to the NRO-HD, which has a nice proof study there, which is the largest trial observational study in the world. So as probably a lot of you are familiar with, like NRO-HD is another prospective registry, so prospective study that will be looking mainly in about clinical data, but also blood samples. That basically integrated 2 previous observation studies. There was the registry study in Europe and the cohort study that was North America, Australia, and Asia. they combined forces and now they have more than 20,000 subjects. And this is really valuable for like a number of different reasons, especially because it gets so much data. And the researchers, they can come back and they can look at this data. There's a database that we can look, and different researchers may come from this. So having such a strong and cohesive group looking at these patients, it's highly trained professionals as well. So usually connected to movement disorder centers that will be looking how these patients will change over the course of years and years. With it generates so much valuable data that it really is vital for these clinical trials that I have. And the burden is not so big. Let's say it's annual visits, so once every 12 months. And we often combine with the clinical visits, so we don't have to go twice to the clinic. So if you don't want to see a neurologist that much, so you just see once. And you can do both, like it's a UHDRS, the research coordinators and research assistants, they help a lot gathering this data as well. It takes some time, but it's like giving a little bit of yourself for now and for the future. I think that this is a lot about sharing here. You may not see what's in the horizon about all the benefits that these will generate, but it's it's a little bit of belief in sharing and be kind to the others that will come in the future. I think this is a lot about observational studies and scientific studies overall are about. Okay, so recruiting many places across the country. So we are Toronto, Calgary, Montreal, Edmonton, Vancouver, Nova Scotia. Scotia was not so sure, but I think it is. So again, best way to connect is talking to the center. Here's some of the names. You can search the EnrollHD website. Great website, a lot of information about HD, a lot of information what they've done with the data so far. So great, it's a good source of information. So again, the selection criteria is quite broad. You have the patients that are manifest HD, pre-manifest, and even family members. They have genotype unknown, genotype negative, family controls, community controls. So we don't only need, solely need the people that have the genotype positive, but we also need people that don't have it or they don't know. So we can have a control group and see the differences between the two of them. Because understanding the differences, it's even more valuable to know about the progression risk factors, so on and so forth, what we discussed so far. So it's basically something that everybody can do and participate. And we tend to have a great community participation, like spouses, family members, friends. They participate, they donate a little bit of their time in an advantage of trying to help others. And this is something priceless and really valuable for the entire community and the researchers. So someone may say that this was just a terrible excuse to say that my Brazilian team won the South America soccer championship for the first time in history, beating the Argentinians, which is even better for us. So, but really to say that teamwork makes the dream work, right? This is kind of a cliche, but it's true. I think that's all about this conference here, is understanding that we have to work as a team. Otherwise, nothing will happen. I think the Huntington has shown that, like the community, that since the beginning, people have been connected. Most of the groundbreaking discoveries in Huntington, they were connected to the community itself since the beginning. So I think that won't be different if we want to move ahead. We got to work together. I think we are doing this. Is you look outside, we happen to have our balls right here. Like this is like extreme and perfect example of what teamwork can do for science, for research, and everything. So I don't know how much time we have left, but I really would like to thank you for the opportunity of kind of paying back a little bit of the HIC community that done for me. and just talk a little bit about one of my passions of research, that is. Do you have any questions?
I don't actually have a question, but I have to comment. We have Huntington's disease in my family, and my sister was one of the early participants in enrollment PhD from the clinic in British Columbia. She lived in Huntington, and she was always really proud that she was able to make that contribution to the future, so that her ability to participate in an observational study was the thing that she could do. And I've been always really thrilled to hear how it's actually made a difference now that we have clinical trials, that research has helped the scientists and the researchers to be able to work towards it.
Exactly. I'll just have to repeat what you said for people online. So we already just said, me, like, said about her sister that participated in her PhD since the beginning and was proud since day one about how much contribution that was giving to the future generations and trying to find better management tools and the clinical trials that we're seeing right now. Anyone else?
Are you associated with Dr. Mandar Jog at the Disorder Clinic at the University of Wisconsin?
No, we are different groups actually. I'm at Ottawa, but we know ours kind of, because Canada is not such a big country in terms of the movement disorders community, so we know each other. Yeah.
But it's not in.
No, he's not in the same group as us. Yeah. Dr. Miller is in London, in the Western.
Yes. I have to look at the clinical trial, but the results will be published next year or something. So it's something. I just want to say close to your Mr.
Yeah, I mean, this is often something that we like. It takes long to have these results, right? And often we put a lot of hope in it, and why not, right? We should. I think this is what I'm kind of advertising on the way. Research. So we kind of put a lot of hope in it. It always comes with the expectations, right? I feel that, I would say most of what we do in clinics these days is managing expectations all the time. It's from day one. And it's the thing about communications, all right? There's a huge gap between what you say, what actually gets out of your mind, what actually is understood, and the expectation that it proves. There's a lot of interference in along the way. And I think like in research, that is the same. Often we say, okay, you'll be participating in a randomized controlled trial that you might get the drug or not. What we hear is like, probably not the drug. It probably this drug will work. It probably this will change. The reality that she might get a placebo, the drug might not work. The drug might not even, the study might not even be completed because there's some terrible side effect that we have to stop. Or sometimes when the results are there, they take forever because a lot of statistics is involved. And when they are finally disclosed, it was added. And we've been through this recently, right? With several number of promising studies that came out negative. And there are like the looked again with different groups and trying to find better solutions. But even though, of course, it's frustrating for everybody, especially for families with Huntington. But I would say that even if it's negative, we are trying. We know that this was tried, didn't work, and now we have to keep moving forward. Because I was talking this to a colleague the other day. Shouldn't we be like trying many different things, shooting everywhere, see if we get anything right? If we don't have a rationale behind it, we are just as far as getting it right as not doing that. So sometimes the steps that are painful here necessarily should get to the goal again. And I really believe in that this is the way it is, even though it's frustrating more often than not. And more often we don't have any answers. We have more questions. So going back to the observational trials, I think they help because they do give data enough to have to make precise or even maybe more precise questions that will help moving forward with our ultimate goal, that is having better treatment. Anyone else? I think we had a raised hand. I don't know how we'll do that. I don't know if the person talked over the online, this will show, but I think it was Diane. Do you want to write your question in the chat box maybe? And then we can see. Yeah, let's see if that appears, I'll come here and talk. So I have to summarize, and in the meantime, if there are any questions, we can obviously discuss about it.
So in the rural agency, does it help if you have like stepbrothers or other family members that are PhD to be involved with that?
Yeah, so it is important, even for people that we don't have, we are not even blood related, it's important because they will be part of the control group, so the group that is unaffected. So it will be a good group to compare with the affected group, and we see the differences and see what is relevant, what's not. So it is as important as having the patients themselves, the subject themselves. It's having everybody that is able to donate a little bit of time to get research. It's a donation, nothing different than that, because we not might have a benefit right away. It's just building up data for getting that benefit along the future. And if I have to say kind of few last comments about it, one is that coming here, and it is a completely different perspective, because every time that I go to conferences, they are like scientific conferences. There are no family members, no patients, and things are completely different in that place. When we discuss about things in theory, when we discuss about things and researchers without seeing how much it affects people, I think has a completely different value. So I really, really believe that this is an opportunity of growing, not only for everybody that's here listening to what I have to say, that probably will figure it out yourselves if you read it, but to know each other a little bit more, to know how this group, this community is so close together. I think this is valuable. Seeing people that are here full of hope and wanting to understand more and want to get better resources. And I think this is something that I would like to congratulate for organizing such an amazing event. And second, if you have the time, please take a look about these studies. Even if it will take you a little bit longer to go another day to the clinic, sit there for sometimes a couple of hours. So I showed you one study that requires lumbar puncture, right? You gotta get CSF out of your spine. It's not something that you'd like to do on a Sunday. So it's not something that is fun, but it is something that will eventually give us so many different perspectives and data that it's so valuable. Okay, I don't know if I can put on the person with the raised hand to talk, because I don't know how to deal with this thing here. But if you want to write the question in the chat box, maybe it's better, so we can discuss this here. Let's see. Yeah, because the raised hand, I don't know. Maybe we can ask. Let's see. And we can. Yeah, I'm not the best one with this technology, as you all can see, right? Okay, is there anyone with the raised hands?
The person who raised their hand, not to unraise it.
Yeah, but I cannot even see that. See,
Just ask.
can you see a raised hand now? I think Diane raised the hand. I can allow you to talk. You know, it feels so powerful here. We'll grant you the ability to talk. Okay, if anyone has a question, maybe I may be able to put you to talk here. Just raise the hand one more time, and I'll grant you the wish to talk. Okay, I did that. I guess not. All right, yes. No, show here. Okay. Anyone, any other comments? Okay. Okay, so in the meantime, I think I'll just finalize. If you decide to get more information, if you want to talk about, if you live in the auto surroundings or you want to talk to us about anything, the best way to reach me is put in my name, which is Gabriel Amorelli, and online Google me, and you find my profile, HRI profile, and there's an email there. You can contact me at any point, and we happy to discuss about what we have going on right now and what's maybe available in the future. So there's my name. Feel free to connect, to talk. I am happy to answer questions. We are starting to have other studies. They're not only the observational ones, some clinical trials with, like we discussed, there like more close selection criteria than the observational ones. But if you are a candidate, we will be happy to have you there as long as we're connected to our university. And you live in the surrounding area. And of course, if you don't and you want to talk and you want me to help get information from the place that you live nearby, I'm happy to help as well. I think that together we can accomplish more things, and I really feel that we can do more if we are able to communicate more. And sometimes there is this gap, right, between the researchers and the physicians and the community, and we often see that, you know, we had that before, like recently we were discussing, there was this line that people could talk directly to the nurse, and we changed for a way that can connect directly to the physicians, and then the calls reduced because people don't want to talk to the physician directly. They feel a little bit, there's, oh, maybe I should not bother with that. I can just, you know, keep going, moving forward. I think this is not such a huge problem. With the nurses, they would feel more comfortable with, and I don't believe in that. I really don't. I'm like I said, I'm Brazilian. I come from a country that from Rio, which is a really informal place, and I love that. I love that this is formality, a little bit of this being closer together to people, and I think this breaks the barriers, and I think we have already two neighbors. So if you can reduce a little bit, I think it's always the best, the way we should move forward. So please feel free to connect, and we can chat, we can talk, and yeah, I am open to it. All right.